Hello and welcome to Dr. Brainwaves. I'm Dr. Susan Raschal and this is Dr. Rena Azar. Today we're going to talk about a condition that you're familiar with, either personally or seeing somebody else with it. It's migraine headaches. We did a video on headaches that you can review at your leisure, but migraines actually is a little bit different. It's amazing how many people will actually handle the pain without getting it evaluated, but these have been around for so long that Hippocrates, 400 or 500 years BC, actually described it in detail, describing even some of the visual auras associated with it. So it has been around for a long time, and there was this procedure that was done. So I imagine people must have been in tremendous pain to actually volunteer or be willing to undergo this, where they took an auger or some kind of device where they burred a hole in the brain to release, like Dr. Azar says, because she read this specifically, to release evil spirits as the cause for the migraine. Well, I'm here to tell you the migraine is probably not due to evil spirits. But Dr. Azar is going to go into some of the things that we know about migraines. Unfortunately, there's not a lot that we know, but what we do know is that it can definitely cause anxiety and depression, and it can definitely interfere with your quality of life. And if you haven't heard us say it one time, you'll hear us say it a million times, and that is, we want for you to have your best life. That's why we want you to watch these videos so that you can make changes, and also that you can live your best life. Dr. Azar.
So migraine headaches were talked about in a prior video that we put out that discusses the difference between tension headaches, migraine headaches, and cluster headaches, which are three of the more common headaches. Migraine headaches tend to be throbbing in nature. They tend to be unilateral, not all of the time, about 60% of the time.
What she means by that is
one
side of the head, not both sides.
Exactly. Tends to occur in the front, the temporal areas on the side, or behind the eyes. And as Dr. Raschal referred to, many people, the statistics are a little variable. 20 to 30% of people will get an aura most always before they get their headache set in. That aura can be flashing lights, blinking lights, streaking lights. That aura can be actually very concerning because it can show itself as a difficulty speaking, difficulty articulating your words, visual loss in a certain part of the field. And I want to say again, if you see our video on alarm headaches, we do emphasize that if you have a headache with those symptoms, you actually first need to go get checked out in an emergency department. However, most people who have migraines on a regular basis will recognize after a while if they're one of the people that gets that particular aura, and they don't have to go rushing into the hospital every time they get their migraine headache. Another notable thing about migraine headaches is that they're very dysfunctioning. The people cannot function when they have the headache going. They usually want to lie down somewhere in a dark, quiet place. And part of that is that during the migraine and before the migraine, people will often have a heightened sense of sensitivity, as a better way to put it, to light, to sounds, to smells, sometimes to touch, and certainly to activity. So they like dark, quiet corner to lie down. That's a migraine headache. I think it's concerning that the statistics say about 50% of people who have migraine headaches are undiagnosed. And what undiagnosed means is that they're probably not treated, because migraine headaches can respond to over-the-counter medications, but they frequently do not. Cause of migraine headaches, not evil spirits. It has to do with blood vessels perfusing or giving the brain oxygen, chemicals, and the nerves in the brain, but it is a neurologic disease of the brain. It is genetic in nature. Also, the tendency to get migraines is definitely inherited. And it's definitely been around a long time. It's a legitimate illness that's very problematic for people. So how do we treat it? We treat it with, firstly, non-steroidal anti-inflammatory drugs, which is NSAIDs that we've talked about before.
And ibuprofen, bufferin, Excedrin, those things.
Very reasonable to use if you catch it early. Very reasonable to use if you know that some or most of the time you'll respond to it. Not reasonable to use is if it's a very severe migraine that you tend to get. If you have some of these really profound symptoms that accompany it. Not reasonable to use if you're having to use it frequently. We usually say 1 to 2 times a week. With that frequency, we start to think about preventative measures. Migraines that are resistant to the use of NSAIDs can have medications like triptans or butalbital or ergotamines used to treat them. And these medications are prescriptions, so you need to know ahead of time that you have a tendency toward migraines and get some at home. I oftentimes really encourage patients, rather than to fill up on NSAIDs, the nonsteroidal anti-inflammatories, rather than fill up on those, try taking one of the more aggressive medications early on to get a faster result, instead of taking anti-inflammatory medications over the counter for 12 to 24 hours before you get effective relief.
One of the things that we've learned about that as well, if people take a lot of NSAIDs, they can actually get a headache from taking those. So that it can be difficult to tease out, especially if you continue to take more and more of them and you still have a headache. Well, maybe because of all the medicine.
Right. That's a rebound headache. That's in another video that we have. But actually, the 2 points that I make in the NSAID video and that we made in the other various headaches is that if you take NSAIDs, and especially if you take a butalbital compound, your tendency to get headaches is going to get worse, because you will now get headaches from taking too many of those medications. In addition to that, NSAIDs are notorious for giving problems with the gastrointestinal tract. So once again, if you're needing to take medicines frequently, then either you need to take something that's more effective so you don't try something over the counter for prolonged periods of time, like a triptan, or you need to look at another alternative, which is prevention of migraine headaches. There's a new group of medications called CGRP inhibitors. There are beta blockers, calcium channel blockers, which are heart medications, certain antidepressants, certain anticonvulsants, and Botox can make you beautiful and also stop headaches. So those are medications that we can use to prevent headaches, and you need to see your doctor for that.
Sometimes people also use some alternative treatments. There are some specialists that will do some manipulative medicine measures, and specifically craniosacral therapy, as well as massage specifically to the head region, and they can teach you how to do some of those things at home as well.
Those measures have been shown to help migraines. Acupuncture is possibly another modality that you can use, but that's not as definitive in its efficacy. It's not as assuredly going to work as these other measures that Dr. Raschal talked about. We really encourage people who have migraines to recognize triggers. Common triggers can be things like flashing lights. Those are easy to avoid. Bright, sunny days are easy to avoid. In addition, certain types of foods can be triggers for migraine headaches. Avoid those foods. Hormonal changes. Sometimes you can see your doctor to have your hormonal migraine headaches, which are also discussed in my video of headaches, other nondescript headaches, because of course there are about 150 different types. But migraine headaches that are hormonally related can be manipulated by your gynecologist with the administration of birth control pills or hormones, oftentimes. Caffeine addiction can be avoided. That can be a trigger for migraine headaches. And then there are some things that you can take control over. Sleep patterns and eating patterns are things that can help to diminish the frequency and intensity of migraine headaches. That's been definitely proven. So those are things that you can do. In addition, we really encourage people to try biofeedback, relaxation, as we referred to before. And the important message here is, if you think you have migraine headaches, if you have headaches that are really disabling, if you have headaches that are not responding to over-the-counter measures to be treated, come in and be seen, because the anxiety and depression rates in people who have repetitive migraines is really high, and it's a very big compromise to your lifestyle that can be avoided.
And we want you to live your very best life. So why put up with something if you don't have to? So thank you for watching Dr. Brainwaves.